Hello and a warm welcome to News Across Nigeria. I'm Melinda Akinlami. Coming up on the program today, healthcare practitioners in Katsina State ask for more enlightenment campaign on cerebrospinal meningitis. Olowura residents in Lagos State want the fence construction on the second route into their community stopped. Kwara State Independent Electoral Commission asks aspirants to produce their tax certificates. The banking and insurance industry workers under the aegis of the National Union of Banks, Insurance and Financial Institution Employees have pulled out of the nationwide strike directed by the United Labour Congress. In a statement signed by the association, they insist that shutting down the sector is not an option as there are crucial issues facing the financial services, allied industry and the economy. The statement, which was signed by the association's new president, Mr. Abdul Rashid Lukman, reads in part, and I quote, "The union just emerged from its delegate conference and a new leadership emerged. There are a number of issues that beg for attention in what has been happening in our industry. Shutting the financial industry at this critical period of our economy is not an option." The Congress is in session and did not discuss, neither did it ratify any industrial action. Therefore, we dissociate Nubife from the planned action of the ULC. End of quote. To health matters now, the Nigerian Medical Association in Osun State has ordered its members to proceed on a 7-day warning strike over the failure of the state government to address their demands. The directive by the Osun NMA chairman, Dr. Tokunbo Olajimoke, is coming at the expiration of the 21-day deadline issued to the government. Rising from an emergency general meeting, Dr. Olajimoke told Channels Television that health caregivers have given the government over 90 days of grace to meet and dialogue, but all efforts have met a brick wall. The Commissioner for Health, Dr. Rafiu Hasamotu, has appealed to the doctors to be patient with the government as their requests are being looked into.
We give about 90 days. We are walking around peaceful protests every one day of the month, and that's the window period, about 90 days. But it's so unfortunate over that 90 days, there was no form of engagement from the government side. And now we came to the issue of 21 days ultimatum, which expired 12 midnight yesterday. And that's warranted us to have a meeting today to deliberate on the way forward. But rising from the meeting of today, we have seen no sincerity on the side of the government to undo the matters at hand. But because of the law for the populace, we don't want them to suffer. And that's why we bended backwards by declaring 7 days warning strike.
We have been engaging doctors. I've held a meeting with them together with all the relevant stakeholders. And I basically told them that of all their demands, 2 of them will be what I will try to pursue: the issue of revised commerce and the payment of 4-month salary when they were on strike in 2015. So I've met with my boss. I've met with a lot of our elders in the profession. So I want to appeal to our colleagues that they should give us a little bit of time. We've engaged them. We'll continue to do that.
Still on health matters, but this time in Katsina State. Following the recent outbreak of cerebrospinal meningitis in the country, healthcare providers in some affected local government areas there have asked for more enlightenment campaign to help prevent the disease. The healthcare providers commended the steps taken by government at all levels to contain it, but insist more still needs to be done to ensure the country remains meningitis-free.
As of March this year, a total of 1,407 suspected cases of meningitis and 211 deaths had been reported from 40 local government areas in 5 states of Nigeria since December 2016. Zamfara, Katsina and Sokoto accounted for 89% of these cases. In June this year, the Minister of Health, Professor Isaac Adewale, officially declared the meningitis outbreak over. In Katsina State, the three most affected local government areas are Jibia, Batsari, and Batagarawa local government areas. In Jibia, a border town, 50 cases were recorded. While commending the efforts of government to check the outbreak, an official of the Primary Healthcare Development Agency in the local government says more should be done.
The local government procure adequate drugs to curtail the situation. Besides the drugs, then we play a greater role in sensitizing community members to know the danger, the causes of the CSM in their various community, to open their doors, windows, and other sanitary conditions.
It's a view shared by this medical officer, even as he outlines some of the factors that contribute to the disease not being contained early.
People usually tend to present late, or sometimes they used to go to pharmacies, chemists, and the likes. So usually before they will present, it would have been late. So I think the enlightenment needs something to be done about it.
In Batagarawa local government, the outbreak claimed 13 lives from the 30 cases recorded, while in Batsari local government area, about 327 cases is said to have been reported, from which 7 people died. Healthcare providers say more enlightenment campaigns must be done.
We have to create awareness at local level. Now, at our hospitals, Gidem Megari, and other places, market, polling station, and in the mosques.
We did health education in various clinics that they should avoid closing their windows, they should be open their windows, and they should, about the environmental sanitation, they will be sweeping their compound always.
From the steps taken by government at all levels to check the last outbreak, it is expected that all is being done to ensure that citizens will be made to understand how they can help to make their communities safe from meningitis.
It's different strokes for different folks, as in Adamawa State, the government appears ready to tackle meningitis and even cholera. The Commissioner for Health, Dr. Fatima Atiku Abubakar, mentioned this in Yola, the state capital, and insists that even internally displaced persons will get adequate medical attention.
The IDPs in Adamawa are actually not from Adamawa. Most of them are from Borno. Most of the people from Adamawa State have actually returned back to their communities. We've had a lot of humanitarian response from our donor agencies, NGOs, and civil society organizations who have also come into those camps to help us, apart from what the state government and the federal government have been doing. There is a humanitarian sector working group that meets every fortnightly in the ministry, and we dwell mainly on the IDPs and the people who have gone into communities and are living in host communities about, their issues in health, like you're asking cholera, meningitis. So basically our preparedness for meningitis when, the outbreak was there. The outbreak for meningitis is normally between November to March. So we were able to send out jingles that was being played on radio and TV, informing people of things to avoid, how to air their homes, to open their windows, because Adamawa is quite a hot state. We advise them on what to do so as to prevent an outbreak of meningitis. And as for cholera, this is the season for cholera, so we're also preparing toward that as well. We have our cholera preparedness plan in place, and we hope to roll that out soon. So some of the local governments are going to be trained on that these IDP camps are, and where we know that most of these people, the host communities where they have gone to resettle in. We're going to be training the health workers in those local governments on how, to respond to any cases of outbreak that we might have.
The Senate President, Dr. Bukola Saraki, has his reservations about the ban being placed on the indigenous people of Biafra and labeling them a terrorist group. We'll give you more on that story and others in a moment. Join us again.